So, yesterday we talked about the second step of the 13 stages of healthy conception, which is egg maturation. This is directly related to egg quality and also egg quantity or ovarian reserve. So, if you've been told that your AMH, your anti-Müllerian hormone level is low, or your antral follicle count is low, or maybe your estradiol is low, or your FSH is high, or you've done IVF and you or egg retrieval for egg freezing and you haven't had many eggs retrieved, all of those are indications that your ovarian reserve is low. So we talked about four little known pathways for improving egg quality. And we talked about specifically nitric oxide production and the increase of nitric oxide production for improved egg quality. And this is really important for the egg maturation process, for the health of the egg leading up to ovulation, after ovulation, and also the health of the fertilized egg and progressing into a pregnancy. So we zoomed in on this pathway of increased nitric oxide production. And we talked about two strategies that you can start implementing right away: one daytime strategy and one nighttime strategy. And these both fall under the umbrella of improving nitric oxide production through a focus on breathing through the nose as opposed to breathing through the mouth. Okay. So, breathing through the nose has a number of health benefits, including the increased nitric oxide production that's associated with it. One simple way that you can breathe through the nose, ensure that you're breathing through the nose at night, is by taping your mouth shut. One of the ways that you can increase breathing through the nose during the day is through setting aside time to deliberately breathe through the nose. Okay. So there are lots of points in the day at which you can check in with yourself and ask yourself, are you breathing through your mouth? Breathing through the mouth is how hyperventilating occurs. Also, there's a lot about how the face develops and how the face changes over time that's associated with breathing through the mouth. But most of us are going around breathing through the mouth a lot during the day. So if we at least set aside time to deliberately breathe through the nose, this is beneficial for nitric oxide production and other aspects of our health and our development, our facial structure, our dental health, etc. And this applies to children too, by the way. So I do mouth taping at night for my older two super babies. My younger he's not quite ready for it. He's not yet comfortable with it. So once they're comfortable with it, then it's a good time to start doing it for your children, your super babies, as well as for yourself. Okay, so yesterday somebody asked me for help understanding how do you deliberately set aside time to breathe through your nose during the day, and specifically how do you do alternate nostril breathing, which is what we talked about as an example of setting aside time. Now, I will tell you that we cover this and all of the other 1,000 pathways that you need to address your egg quality and your fertility and pregnancy system more broadly. We cover all of these in depth in the Primester protocol. So what's so spectacular about the Primester is that we have the breadth, meaning that we cover all of the possible pathways that matter, but we also have the depth, so we cover them in great detail. This is an example. I wouldn't be able to cover everything here, but let me just show you how you can do alternate nostril breathing. Okay. So you're going to use your thumb and your ring finger. And you can, if you want to, you can put your index and your middle finger right here, which is considered by some, or in some traditions, the third eye point, which is kind of like a meditation or relaxation point. So it's really soothing if you do this. You might find, like, when you're stressed, you just naturally do this. There's a reason for that. Okay. So you can try putting these two fingers in your on your third eye point if that feels comfortable to you. If not, then just let them kind of go fall where they will. I hope you can hear me okay, even though I'm kind of covering my mouth while I'm talking. So I'm going to put my index and middle fingers on the third eye point, and I'm going to put the ring finger and thumb near my nostrils. Okay. So you're not going to close both nostrils because then you would need to breathe through your mouth. You're going to close one nostril at a time. So first, I'm going to close my left nostril with my ring finger. And I'm going to breathe. So I have my left nostril closed and my right nostril's open. You can see my thumb's hanging around, but it's not closing it. And I'm going to breathe in and out through my right nostril. And then I'm going to alternate and I'm going to cover the right nostril and I'm going to breathe in and out through my left nostril. And I'm going to keep doing that. Okay. Alternating. And try to do that for 30, 60, 90 seconds. Work your way up. So here we go. Okay, just like that. It's so soothing and relaxing, but it's also deliberately breathing through the nose to increase your levels of nitric oxide, which are so important for your egg maturation and egg health, your egg maturation process and egg health. Okay. So you get the idea. Set aside a little bit of time in the morning and the evening for doing your alternate nostril breathing. And like I said, we cover this and all of the other things that you need to know in order to get pregnant, stay pregnant, have your super baby, which is your healthiest, happiest, brightest, most well-adjusted baby you can possibly have, who is neurocognitively strong and as resilient to the stresses of the modern world as humanly possible in the Primester protocol. The doors to the Primester protocol are now closed, but you can get on the waiting list. And in the meantime, you can comment on this video the word fertile or DM me the word fertile, and we will send you a gift, a free resource to help you on your way. So if you're somebody who's experienced miscarriage or other pregnancy loss, you're afraid of experiencing miscarriage or other pregnancy loss because of your age, or you have a diagnosis that makes you feel really worried about your ability to get pregnant, stay pregnant, and have a healthy baby. Maybe you have PCOS, maybe you have endometriosis, maybe you have fibroids, maybe you're diabetic, maybe you have an autoimmune disorder, maybe you're suffering from depression and anxiety, maybe you were abused as or neglected as a child, or you've been abused in an adult relationship. Maybe you have a very high stress life, a very high stress work environment, very high stress profession. All of these things put you at greater risk for having difficulty getting pregnant and staying pregnant and having a healthy baby. And you might see this reflected in your menstrual cycle if you have a long cycles, irregular cycles, a short luteal phase, if you have irregular bleeding, all kinds of things, then you're seeing this reflected already in your reproductive system before even trying to get pregnant or being pregnant. And if you're farther along in your reproductive span, so you're wanting to have a baby later than most people do, later than average, then you might also see some things that are different about your menstrual cycle that may be an indication that it could be difficult to get and or stay pregnant. So it might be that you have a shorter cycle, which is one of the first signs of reproductive aging, by the way. The menstrual cycle might get 1 or 2 days shorter. So you might see the days of your period, the days that you're bleeding, getting shorter. You might see your period becoming thinner. The blood is more pale, there's less of it. For example, you might see your luteal phase getting shorter. That's also one of the earlier signs of reproductive aging. So the time between ovulation and when your period starts again gets shorter and shorter. And this is a sign of being a little bit farther along in the reproductive span that most people don't know about, that older, quote unquote, older women, so in their 30s, 40s, and beyond, tend to ovulate earlier in the menstrual cycle, which can really affect your ability to identify your fertile days and also your peak fertility days. So I want you to really be aware of these things and pay attention, because when you start making changes like leveraging the pathways that we've been talking about over the last few days, over the last few weeks, and that we're going to continue to talk about next week as we wrap up the month of February. And then we move into the third stage of the 13 stages of healthy conception. As you are leveraging these pathways, you will start to see the difference first in your menstrual cycle. You may also begin to see the difference even before your next menstrual cycle in your mood, in your psychological hygiene and habits, and how stable you feel internally, because there are these intricate and important feedback loops between our psychology and our fertility. That's why the psychosexual level is the base of the fertility and pregnancy pyramid that we use at the Fertility and Pregnancy Institute and in the Primester Protocol. It's not a coincidence that when you take care of your fertility, you see that reflected. And sometimes it's among the first changes that you'll notice in your psychology, in your emotions, and in your ability to feel steady and stable and grounded inside. Okay, that's one of the beautiful things that happens when we primester. Digestion gets better, mood gets better, anxiety starts to lift, depression starts to lift, and your partner and all the people who know and love you will all of a sudden be like, wow, you're so much more steady than I've seen you before. All right, so I'm gonna stop there. I'll be back to see you again next Tuesday. Meet me here live next Tuesday. I Let me just look at my calendar. I should always do this before I come to see you so you know what time. Okay, I will plan to be here with you next Tuesday, sometime between 8 and 9 a.m. Pacific, probably closer to 8, but sometime between 8 and 9 a.m. Pacific. I will be here to see you next Tuesday. So meet me back here. In the meantime, comment fertile on this post, or send me the word fertile via DM, and I will send you a resource to help you on your way, to help you get started. I see Mama Alexandra saying, I have one and trying for another one, but I can't get pregnant. Well, Mama, overwhelming odds are that you can get pregnant. You just need to leverage the right set of tools in order to get your fertility going again, get pregnant, stay pregnant, and have your healthiest baby. And that's what we do in the Primester Protocol. Let me start by helping you with an important free resource. So comment on this video, the word fertile, or for your privacy, send it via DM, and then we'll reply with the resource for you. Okay, sending you warmest wishes. Thank you for all the love, everybody here. I can see you all on Facebook. And thank you so much for all the love, everyone on Instagram, Twitter, YouTube, LinkedIn. Seeing you all there. Thank you so much. Sending you so much love. Okay, I'll be back to see you on Tuesday sometime between 8 and 9 a.m. Pacific. That's 11 a.m. and noon Eastern time. I'll see you then.